Hi, in this video, I'm going to be talking about breast cancer and mental health. I'm going to talk about the kinds of things you can experience, the types of treatments that can cause changes in mental health, and then some strategies for addressing any mental health issues that arise. About a quarter of people with breast cancer are diagnosed with depression. We most likely underdiagnose and undertreat depression in our patients because many of the symptoms of depression look like the symptoms of treatment. I'll get to that more in a moment. Other things that we see a lot in people who've had breast cancer and its treatment are anxiety. We can see problems with attention problems. So maybe undiagnosed ADHD becomes diagnosed during breast cancer. We can see post-traumatic stress disorder, either during cancer treatment because certain things are activated from the past, and also after treatment is over, people can actually have symptoms of post-traumatic stress. We see problems with sleep, we see problems with mood, outside of depression where people are emotionally labile. So there are a lot of things that can happen during breast cancer and its treatment, even if you've never had problems before. I'm going to focus on depression for a moment. Depression shows up in many different ways. We can see people sleep not at all. They have trouble sleeping. They have trouble falling asleep or staying asleep. Early morning awakening is a common symptom of depression. We can also see people sleeping much more than they usually do. So all they really want to do is sleep. We see changes in appetite, people eating more or people eating less. It's not really clear who's going to fall into which camp, but changes in appetite are a common symptom of depression. Problems concentrating or paying attention, loss of pleasure in anything. One of the biggest, most sensitive questions that I ask my patients when I'm concerned about depression is there anything you're looking forward to, whether that's today, tomorrow, next week, or next month? And when people have complete lack of pleasure, there's a very high likelihood that they are experiencing depression. With depression, people they can feel frozen. They just don't feel much emotionally, or they can be very labile and irritable. They can be quick to anger, or they can be very tearful, even when it's not clear why they're crying. So you can see there are a whole host of things that can show up as depression. I've not included all of them here. I'm sure if you've been through this or know somebody who has, there are other symptoms that you know of, but those are the key ones that we think about. Other problems, as I mentioned, include anxiety, and we have another video on anxiety. We can also see problems, as I mentioned, with attention. We can see people who struggle with addiction to substances. So that's actually one of the things we see with depression, more use of alcohol or weed or other mind-altering drugs. But we can also see substance use increase in people undergoing treatment for breast cancer and really any cancers. We know that cancer is actually a risk factor for suicide. So it's a very serious thing, your mental health and breast cancer. I often say if you don't have your mental health, it doesn't really matter about your physical health, because our mental health is really our being. It's how we show up in the world and how we relate to other people, how we get through the day. So there are a whole lot of things that can happen that breast cancer can trigger. So a few other things to know: if you are younger at the time of diagnosis, if you are a member of a historically marginalized group, if you have a history of trauma or a history of depression in the past, all of these are risk factors for having mood problems, in particular depression and anxiety, in response to a breast cancer diagnosis and its treatment. There is nothing wrong with you. You are not weak. There's nothing you've done wrong. This is just one of the things we know happens. I also want to talk a little bit about how treatments can be associated themselves with depression in particular. Chemotherapy has been shown to be associated with anxiety and depression. It may be because people getting chemotherapy have more active disease. They're at relatively higher risk. So there's the worry about cancer recurrence. But we also know chemotherapy and hormonal therapies can affect our normal body's homeostasis. So if chemotherapy puts you into menopause temporarily or permanently, we can see mood changes that we see normally with the cessation of ovarian function. Endocrine therapy can affect mood. It can make us irritable, and it has been associated with mood disorders, both tamoxifen and the aromatase inhibitors. A lot of this is due to shifts in hormones to which we need to adjust, but it's also the intrinsic effects of these medications. Again, if you develop symptoms that sound like depression, or if you find that you're on edge and anxious and unable to sleep, I would encourage you to question whether or not you might be living with depression or anxiety or other mental health problems, and talk to your medical team, reach out to your community and other resources. There are lots of different treatments for depression and anxiety. It doesn't mean you have to go on medication. We do know medication can help people. I tend to view it as a short-term support rather than being on something long-term, and that might help you think about if you are offered medication. If you have a history of depressive episodes in the past, multiple depressive episodes, 2 or more, we do tend to recommend that you stay on antidepressants longer term, though they may need to be switched. I'm not going to spend a lot of time on that, but if you have questions or comments, please put them below and I can go into more detail. In addition to medication, which a lot of people think of as the only treatment, actually there's so many other things that we can do. There's everything from talk therapy, talking to somebody who's used to talking to people who are going through something serious. You can talk to your primary care doctor. Primary care doctors are really good at knowing resources in your community and knowing whether or not medication might be right for you. There are different types of therapy. There's cognitive behavioral therapy. There's acceptance and commitment therapy. There's psychoanalysis, which is more involved and tends to be longer term. And there's supportive therapy where you just process what's going on. It's sort of a form of narrative therapy where you look at the stories you're telling yourself and are there alternatives to those stories that are equally possible and can help you feel better and more engaged. There's support groups that can help. Feeling less alone can be really beneficial if you're struggling with depression. The key thing that I want to do is normalize this. Doesn't have to be a secret. Like I said, there's nothing wrong with you. These are things we know. 1/4 of people with breast cancer have a diagnosis of depression. So you are most certainly not alone. That's 1 in 4 or 25%, however you want to look at it. That's pretty common. Now, we want to be careful not to overdiagnose. It's normal to have feelings of sadness and irritability when you're going through something so serious as breast cancer and its treatment. But it's also important not to deny yourself the help that you could be getting in the short term. If you have a history of trauma, we have very effective treatments for trauma, and seeing a trauma specialist is something that many insurance companies are now covering. And I would really encourage you, if you're finding that you're having reawakening of trauma symptoms or new trauma symptoms like flashbacks and irritability and being hyper aware of your surroundings, having sleep problems or nightmares, all of these things can indicate that you might benefit from trauma therapy. I have covered a lot in this video and I haven't covered everything that's out there. If it's been helpful, click like and subscribe. And as I mentioned, put a comment or question below. As always, you can visit yerbba.com for your personalized report and follow us on Instagram as well.